Welcome to the No More Meds podcast with Dr. Corinne Weaver. Are you stressed out because you keep getting sick and don't know what steps to take? Are you sick of not getting answers from your doctor and always needing to take drugs? How would your life be different if you were healthy? Be inspired and stay tuned for some practical solutions for healthy living.
Welcome to the No More Meds show. We are so excited to have a guest speaker with us today, and his name is Richard Capriola, and he has been working with children that has addictions and mental health. He's been a counselor for over 2 decades. He was licensed in Illinois and he's licensed in Texas. He's recently retired as an addictions counselor from the Menninger Clinic in Houston, Texas, where he treated both adults and adolescents diagnosed with mental health and substance use issues. He is the author, and that's the book that we're going to be talking about today. And the name of that book is The Addicted Child, A Parent's Guide to Adolescent Substance Abuse, and its companion parent workbook, which I'm excited about learning about the workbook itself. So tell me, Richard, how did you kind of get started into working with people with mental health issues?
Well, I actually started when I was in Illinois. I'm from Illinois originally. And when I was working for state government in Illinois, I also worked at a mental health crisis center. It was a regional mental health center that provided a crisis center. And we would have people come in from the hospital to the crisis center, and we would provide services to them. And I noticed that in addition to having a mental health issue, they also had a substance abuse issue, over half of them. So I went back to the University of Illinois, got a master's degree in addictions and addiction counseling, and then continued to work at the crisis center until I was offered a job with Menninger Clinic in Houston, Texas. Menninger is one of the top 10 psychiatric hospitals in the nation. And I was offered a job as an addictions counselor and moved down here to Houston and began treating adolescents and adults diagnosed with both a mental health issue and a substance abuse issue.
Oh, that's an awesome story, Richard. And you know, you are retired. Is that what it said? Retired?
Yes, I retired from Menninger a little over a year ago.
Okay, so what makes you now want to get on podcast and get your story out there? It sounds like you have a lot of hope to offer parents. So what kind of got you into just not, hanging out and watching TV and, putting yourself out there?
Aside from the virus?
Right.
Well, actually, I thought about writing this book shortly before I left Menninger, because I had worked with so many parents who had sent their child to Menninger in a crisis situation. And one of the most common responses I heard from parents after sitting down with them and going over their child's history of using substances and giving them the diagnosis, one of the most common responses I heard from parents was, I had no idea this was going on. Or if they did suspect their child was using something, I would hear things like, I knew this was going on, I just didn't know it was this bad. So I wanted to provide a resource for parents and anyone really interested in learning about adolescent substance abuse that would give them the tools and the information they need so that they're not caught by surprise, so that they know what the warning signs are and they have resources for themselves and their child if needed. And then I actually started writing the book after I left Menninger. It's been about a year in terms of writing and editing and production, and it was just released a couple of months ago.
That is so awesome, Richard. I can definitely tell in your voice just the passion that you have to help. And, a question that I would like to ask is, what substances are being used by today's teens?
Well, I think the most alarming finding that we're finding from the most recent research is a tremendous increase in vaping. Adolescents are vaping nicotine and they're vaping marijuana. And we've seen in the last few years a dramatic increase in the amount and the number of kids that are vaping. For example, just in the last 3 years, the percentage of seniors who are vaping nicotine, for example, has gone from 18 18% to 34%. The number of juniors has gone from 16% to 31%. And if you look at marijuana vaping, the number of seniors, the percentage of seniors who are vaping marijuana has gone from 9% to 22% just in the last 3 years. So that's a tremendous surge in the number of high school students who are vaping either nicotine or marijuana. We also continue to see adolescents using alcohol, which is the most widely used non-illicit substance being used. And about a little over 50% of seniors and 40% of juniors admit to using alcohol. Now that's down considerably from the 1970s, from 1991 to 2004. Instead of being 70%, it's now around 50%. So alcohol is still widely used, not as much as it was in the past. But I think what concerns me most is the tremendous surge in vaping of either nicotine or marijuana. Cigarette smoking has declined substantially, but it seems that kids now are turning to vaping nicotine rather than smoking cigarettes.
And do you know if the vaping, I've heard, can actually cause more damage? Is that true? I don't know if you've done any research with that versus just smoking the cigarette.
Well, the teenagers will tell you that it's safer than smoking cigarettes because they're just vaping the nicotine, whereas with smoking cigarettes, they're getting hundreds of other carcinogenic substances with the tobacco. The problem is that though they're vaping nicotine at much higher levels, it's much more concentrated. And whether it's smoking cigarettes or smoking nicotine, they are inhaling into their lungs a substance that really shouldn't be there. And then also, because of the adolescent brain still developing, putting these high concentrations of nicotine or marijuana or any substance really into a developing brain runs the risk of doing more damage to the system.
Right. And that's probably where they think, oh, I'm doing something more healthy, or think they're doing something healthier, but yet probably is more addicting.
Yes, absolutely. That's exactly what they say. They feel it's more healthy, but they don't recognize it's also much more addictive.
Addicting in part. So what warning signs does parents, or should parents or even families or friends look for in a person that has that addiction behavior?
I recommend that parents pay attention to any changes they see in their child. They may be normal developmental type of changes, but they also may be early warning signs that something is going on below the surface that they need to pay attention to. So parents should pay attention to any changes that they notice in their child. These might be changes in behavior. They might be changes in appearance. For example, a child who used to be very proud of the way that they look no longer cares about their appearance. A child who used to participate and enjoy sports is no longer interested in sports. A child who used to openly introduce you to their friends, you knew who their friends were, now becomes very secretive of their friends. Perhaps it's a change in sleeping pattern. Perhaps it's a change in eating pattern. These are all warning signs that there might be something going on that parents need to pay attention to and follow up on.
Yeah, that's very good. And it's hard because in 2020, there's been a lot of changes.
Yes.
That's hard for kids. And I'm sure we don't know the effects, especially looking at the mental health. What is the mental health going to affect of 2020 of kids not being able to do the social things, the sports things, missing out on, friends and stuff like that. So have you seen anything? I know you've been retired, but talking to other counselors in the last year, have you seen any major structural changes with the mental health with children?
The thing is that we believe that as we go further down the road, there will be a higher demand for mental health services, both for adults and for children. We are still in the midst of this crisis. Many children are still isolated at home. Many parents are under tremendous stress because of their routines being disrupted. Children have been alienated from their social friends. They've been alienated from their social activities. So I think it's going to be a while until we start to see the ramifications of this filter through the system. But there's no doubt that these type of changes are going to have an impact on children and parents.
What kind of advice do you see? It's probably in your book, and I know you I guess you finished it before 2020. But what kind of advice do you see that for parents, if they start seeing those changes happen, is there any quick tips that you can give our listeners to kind of act on before it gets too much involved?
Well, my book goes into a chapter that deals with assessments and tests. And if a parent suspects that there might be an issue going on, perhaps it's, they suspect their child might be drinking alcohol or smoking marijuana or whatever it is, it's important, number one, that they don't ignore it, that they don't minimize it, and that they seek help. And that begins with a comprehensive assessment. My book describes the various assessments that are important because it goes beyond just an addictions assessment. It goes beyond just a substance abuse assessment. That's an important part of assessment, but it's only one component of a comprehensive assessment. The other components involve a complete physical exam. You want to rule out anything physically that might be contributing to your child's behavior. It requires a comprehensive psychological exam, sometimes a neuropsychological exam, because you want to see if there is anything psychologically going on. So you want to put together a battery of tests, a battery of assessments, so that you can get a comprehensive assessment and a comprehensive diagnosis, and that will lead to treatment options.
Yes, and me being a doctor, I totally understand what you're saying. Everybody is so individualized, and especially their brains. And, we're seeing more and more kids have addictions, but they tend to have a brain imbalance, right? There's a chemical imbalance that's kind of creating that. Is there certain chemical imbalance that you notice that can be helpful through? Do you discuss like nutrition or anything like that could help help parents or children?
Well, my book does have a chapter that I wanted to put in on the neuroscience of addiction. And it helps parents understand, number one, that the adolescent brain is still a brain in development. Our brains don't get fully developed until around the mid-20s. So I wanted parents to understand the crucial aspect that their child's brain is still developing. It's very young and it's developing. And there's a particular area of the brain called the prefrontal cortex that's really the last part of the brain to get developed, but it's important because it helps us make rational decisions. So that part of the book, that chapter of the book, really is meant in non-technical language, in very layman's language, explain to parents the importance of the developing brain and how these drugs work within that brain to increase a chemical called dopamine, which is a pleasure chemical. And that really plays a big part in why these kids get the pleasure out of a drug. So that chapter really educates parents on what's going on in their child's brain.
I think that's great. I'm glad you brought that up because I love the dopamine. There's different things that increase the dopamine, right, in the brain. There's different supplements, and I heard it's the love hormone, right? You fall in love, and then you get the dopamine, and that's how it feels, right? So that's the chemical that can trigger that. And I know with those addictions, they kind of keep wanting to support that and wanting to fill those neurotransmitters up right in the brain.
Yes,
So
dopamine is the chemical that helps us feel good. The problem with drugs is that just about all drugs cause a huge surge of dopamine in the brain, far more than the brain was designed to handle. So that huge surge of dopamine, whether it's marijuana or cocaine or meth, that huge surge of dopamine is what is responsible for the kids feeling the feeling that they have. The other issue that I wanted parents to understand, which is associated with that huge surge of dopamine and those pleasurable feelings, is that if you look beneath the surface, if you go beyond just looking at the alcohol and drugs, you may find an underlying psychological issue why your child is using, say, marijuana. And that's important to know. That's why we have these comprehensive tests. The large majority of teenage girls and boys that I worked with were smoking a lot of marijuana, multiple times a day. And when I asked them to help me understand why they use so much marijuana, the number one answer I got was, it helps my anxiety. So once we look beyond the alcohol and drugs, we may find an underlying psychological issue or perhaps a medical issue that the child is using the drug to medicate.
So how do you protect especially you're saying preteen, are you saying like around age 10, 11, are you seeing some kids that young kind of get into this alcohol and drug use?
Not so much the alcohol and drug use at that early age. What we tend to see at the very early ages, the 7, 8, 9, and 10 year age, is inhalant use, where they will use inhalants because they're very, very common household products that they can use to inhale. It could be glue, it could be paint, it could be a lot of substances that we have around our houses. Well, we tend to see that inhalant used at very young ages. It trails off by the time they get a little bit older. By then they've turned to alcohol and marijuana. But at the very young ages, it is inhalant use. And the issue with inhalants is they act very quickly, but they don't last very long. So kids tend to use them repeatedly, which can be more damaging. And their brains are even younger at 7, 8, and 9, and 10 years old. So it can be very, very toxic to their brain.
Yeah, so those permanent markers, don't be smelling those Sharpies.
That's right. That's right.
They are pretty strong, those markers.
They can be, yes.
That makes sense. Some of those, kids would get, and we would eat what we would eat. I feel like I would eat the glue or smell the glue, and I didn't even really know what I was doing back in and I was on a lot of medication as a child. Yeah. They were prescription medication, but they were very addicting as well. And it was hard for me to detox. I had a webinar this morning about detoxing and how important that is to open up those pathways. But I didn't realize how I became addicted to prescription drugs, which can be the case too. And I'm sure, I don't know if you ever got involved in prescription painkillers. Did you ever have to deal with patients with that?
Not so much with adolescents, but I saw a lot of that with adults that I treated, getting involved with prescription opiates. And sometimes those addictions leading to even more hardcore drugs. I think in the prescription drug area, what I saw most among adolescents were prescribed drugs for ADHD. The Ritalin, for example, the Adderall. Not only would kids abuse them, but they would also sell their prescriptions to other kids. I saw a lot of that going on too. So it's not so much opiates, it's more the attention deficit type of prescription drugs that I see abused. And it's not certainly anywhere near the percentage of kids that are drinking alcohol or using marijuana. It might be 3, 4, 5% of kids, but that definitely is a concern that's out there.
So what are the differences between the adult, we kind of got into a little bit of it, but the adult and adolescents addictions?
I think there's two big differences. First, we've already talked a little bit about, and that's brain development. Adolescent brains are not fully developed. Adult brains are fully developed. So the first big difference in adult addiction and adolescent addiction is the brain development. The second difference is consequences. Adults who have become addicted to a substance and many times have faced catastrophic consequences. They might have lost a marriage. They might have lost a family. They might have lost a job. They might have been incarcerated. So in many cases, adult addiction has involved catastrophic consequences for the user. The adolescent, on the other hand, has not received or found a lot of major consequences. Their big consequence has been their parents yelling at them, or maybe imposing some type of restriction, but nowhere near the catastrophic kinds of consequences that adults face. So brain development, consequences, those are very big differences between adult and adolescent addiction.
Another thought too is something that came up actually in my own household. Was, there's a lot of kids right now that are basically just getting, I won't say Zoom calls, but they get on Instagram and they kind of chat behind the scenes there. And my daughter, she just turned 14. And, she was actually talking to some of her friends in this chat, and they were mentioning drinking alcohol. And she, obviously knows that's not right. And she ended up getting off the chat. But it was nice that she came to me and just recently told me this, that these kids in here were like, oh, my parents have alcohol here, and they won't know if I just open one beer or open this and that. And I'm talking about these kids who are probably 12, 13, 14, already starting to figure out ways to drink alcohol in the home without their parents knowing. Now, I am blessed because I have a daughter that did tell me that. But as a parent, how do you address, because I don't know these parents, I don't even know these kids, but how would you address like another parent knowing, should I reach out to that parent and say something to this parent that this kid is doing? And maybe she's not or he's not, but they're talking about it.
The one thing that I heard you describe about your daughter is very encouraging, because one of the things that people ask me sometimes is, I don't have a teenager, my child's like 8 or 9 or 10 years old. What can I do to, keep them away from alcohol and drugs? And my recommendation to them is begin at a very young age to develop that communication and that trust with your child so that they feel comfortable talking to you. A survey that was done asked kids, what is it that keeps you from talking to your parents about any problem that you have? Maybe it's substances, maybe it's something else, but what is it that keeps you from talking to your parents about it? And over 50% of them said it is a fear of being judged. They were afraid that they were going to be judged by their parents. So my recommendation is begin at an early age, or any age really, and start to develop that sense of trust so that they feel comfortable coming and talk to you like your daughter did, because that is so important to try to develop and nurture. And many times parents are unaware that their child's drinking alcohol. I had one young man when I was at Menninger who would exchange the vodka in his parents' liquor cabinet. Vodka is a clear substance, so he would go in, he would take what he needed, and he would replace it with water. So they can be very clever at trying to hide their alcohol use, and many times it's happening in the home with the parents not being aware of it. I would advise a parent to, and this just doesn't apply just to alcohol, it applies to all the medications that they have at home. Secure them. Make sure that your child does not have easy access to the medicine cabinet or where the alcohol is located, because you'd be surprised at the number of kids who are getting into the medicine cabinet and taking just a portion of some of the medication that's in there. And if their child is prescribed a medication, parents really need to monitor and make sure that they're being very careful with those medications as well.
I'm glad you brought that up because, there's so many people that do drink, wine or beer, alcohol, whatever, and just leave it kind of in the kitchen and just kind of leave it available and not really thinking that their kids would even get into it. So, knowing my daughter and her having this conversation with just some of these, school kids, I was actually shocked. It's like, as a parent, you're like, you always assume your kids are doing the right things. And for you to say, we don't have it in our house, but other people that drink it, they need to be aware to lock it up or put it in a secure place that their kids can't get it, because knowing what you see and what we're hearing, it's more and more.
Well, I think also with that issue, what concerns me is a lot of these young men and women don't see a lot of harm associated with either smoking marijuana or drinking alcohol. For example, only 24% of seniors say it is a great risk to have one or two drinks a day. Okay, one or two drinks a day, seniors say, I don't see any big deal with that. Having five or more drinks once or twice a weekend, only about 30% of seniors say that's a great risk. So they don't see a lot of risk involved with drinking alcohol or using marijuana.
Right. Where do you think they're missing that? Is it just not the education? Because I remember obviously going to school and we had the big dare
Yes.
dog and stuff like that. And there was a big drive in the 80s is when I went to school on, say no to drugs. Of course, it was still going on. But there was a big drive for that. Do you think we've lost that within our community or with our school system? Or is it lack of education?
I think it's lack of awareness. I think it's lack of teaching young men and women the dangers associated with drinking alcohol or using marijuana at such an early age. What I found was most helpful in dealing with them was the neuroscience behind the alcohol or the drug use. Me telling them it's illegal, their parents telling them it's illegal, they've heard all of this. It goes right over their head. But what I did notice captured their attention is when I could have a discussion with them about what substances are doing to their brain, how it affects their brain, and to educate them about the need to protect their developing brain. That they paid attention to. So part of this is education and reaching out to them and helping them understand, not in a judgmental way, but in an education way, how these substances can develop their brain and help them to understand the importance of protecting their brain. I think there are two issues that drive adolescent substance abuse. One of them we just talked about, their perception of harm. They do not see alcohol and drugs as being very harmful. The other is availability. Kids will tell you, for example, about almost 80% of seniors will tell you that it's very easy for them to get marijuana if they want it. About 30% of them will tell you it's easy for them to get LSD if they want it. Over 80% of them will tell you it's very easy for them to get alcohol if they want to find it. And a large percentage of them will tell you if they want to find a vaping device, they can. So low perception of risk, low perception of harm, also easy availability are two factors that contribute to what we're seeing with adolescent substance abuse.
Yeah, that's really good. So, this is really good information. It kind of gets me thinking because I do work with a lot of kids, and sometimes we kind of gloss over that area and them thinking they're not, into the drinking and vaping and those things, but they do hide it. Like you said, they're really, really smart and paying attention. And I've known parents that I find the vaping and, they'll hide it from their parents and they know it's bad, right? Like you said, it's like they don't think it's that bad, but they know it's bad enough to kind of hide it from their parents. So there's that conscious that's still kind of there that you can hopefully get to light up and open that door so they realize what they're doing. Like you said, opening the door up, letting them know what's happening to their brain. Because if they want to be a doctor or if they want to, do something in college and to have that prefrontal, cortex is very important to get the learning aspect of it. That's a one way that we can, as parents, to talk to our kids about the healthy brain.
It is important because the young men and women that I saw who were smoking a lot of marijuana, when I would see the test results come back, like the neuropsychological tests come back, almost all of these kids were very bright, they had superior IQs. They were very high, very intelligent young men and women. But the processing speed of their brain was below average. Their short-term memory was impaired. And many of them would say that it sapped the motivation out of them. So even at that young age, when they're smoking a lot of marijuana, we begin to see deficits in their short-term memory and in the processing speed of the brain. So they may be sitting in class and stuff's coming at them real quick and they're just not catching it.
Do you feel like they mix that? Do you feel like they mix marijuana and you're talking about the Ritalin? Have you seen that because of the processing speed to speed it up?
No, I haven't seen that so much. What I've seen with a lot of the marijuana use is kids just saying, I can't take this anxiety anymore. You know, I can't take it. I haven't found anything that helps me. And they don't want to try some of the coping skills that don't involve medication, slow breathing and things like that can help with anxiety. They want the quick fix, you know, and I think that once they find out through one way or another that marijuana does slow down their anxiety, then they're going to keep using it. But what I would tell them is that, yes, perhaps the marijuana is helping in the moment with your anxiety, but it will have a rebound effect. It will actually make your anxiety much worse in the long run. But they want the quick fix.
Right. Well, that's why most people tend to go to drugs anyway, right?
Absolutely.
So let's just fix this real quick.
Yes.
And you probably can notice certain personalities too. So the personalities that have, you're saying that have more anxiety or tend to have more of the anxiety or leaning more towards the marijuana. And I guess the ADD or the AD are more hyper type of kids or things that want to be able to help focus. They kind of lean more the Ritalin.
Yes.
Okay. And so in your book, do you describe those personality types to try to help their, in that questionnaire? I'm sure that's probably labeled what personality type or what they're, seeing in their child, to try to hit those centers to kind of help those pathways in the brain. Now that I'm saying it out loud, I'm sure you have something like that in your questionnaire.
Well, I don't really get into specific diagnoses because each child is different and each situation is so much different. What I do advise parents is get a comprehensive assessment. Let's find out what's going on, especially in the psychological area. Let's find out if your child is perhaps using a drug because of anxiety or depression. I also saw a number of children that were using marijuana who were also self-harming. They were cutting. I saw a number of girls, for example, who had eating disorders. So these disorders of self-injury and eating disorders can often accompany a substance use disorder. So again, we get back to the issue of a comprehensive assessment that looks at all of these factors, because if you're dealing with a young man or a young woman who's, say, smoking marijuana for anxiety, but also cutting themselves, or perhaps has an eating disorder, you need to treat both of those disorders. You can't just treat one. If you treat one, the other one's likely to increase.
Now, in your workbook, how does your workbook play with your book?
The workbook I developed primarily to help the parents. The main book is to educate them and give them resources. The workbook is to give them an opportunity to express what's going on with them, to express their feelings about going through all of this with their child, because they're going through their own emotions and feelings as well. Maybe it's fear, maybe it's guilt, maybe it's how did I miss the warning signs? So I wanted to have a resource for parents where they can go through and they can express their feelings, where they can talk about the substances their children are using, where they can have a couple of exercises to deal with anxiety. So I wanted the workbook to help the parent.
Do you still see clients virtually?
No, I do not. Nope.
So do you have a list of doctors that you recommend, or are you looking for certain doctors within where patients live?
That's a really good question, because my book talks about, okay, you have all of these assessments that need to be done. Where do I turn to get them? And what I recommend first is if you have a primary care physician, if you have a family physician, let's start there. Usually they can give you referrals to other professionals. You might need to see, for example, a child psychiatrist, or your own family physician may be able to issue any medications that are needed. But certainly your family physician can be a source of referrals to getting these other assessments done. For example, they might recommend a psychologist that can do a neuropsychological exam. They can recommend an addictions counselor who can focus on the addictions. If you don't have a family physician, then you can turn to community resources like your local mental health organization. You can turn to your school counselors. Usually they will have sources that they can refer you to. So there's a number of people that you can turn to that can make referrals for you to get all of these assessments done.
Well, I appreciate that so much. And, with the listeners today, if you have a teenager or if you're a grandma and have grandkids and you're listening, these are definitely some thoughts to start thinking about with your children, especially with the big changes that we've had in the last year.
Yeah.
Ways to get on top of it before it gets too late. So, Richard, thank you so much for being on the show.
Well, you're very welcome. I appreciate the time talking to you, and hopefully providing a resource for your listeners.
You sure will. Thank you.
Thanks for listening to the No More Meds podcast. If you enjoyed this podcast, please share your favorite episodes with your family and friends, or at least leave a review on iTunes or Stitcher. The content and opinions expressed are those of the host and presenters. They are not intended to diagnose, treat, cure, or prevent disease. Product statements have not been evaluated by the FDA.